Okay, it's 6 o'clock, so I'd like to call the Tuesday, February 6th, 2024 City Commission meeting to order. And could we call the roll?
Mayor Butler,
Here.
Commissioner Adamchak,
Here.
Commissioner McCullough,
Yes.
Commissioner Opelt,
Here.
Commissioner Motta.
Here.
Mayor, we have 5 commissioners present. The quorum of 3 is met.
Okay, excellent. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, this is the first legislative meeting of the month, so we have a section here for public comments. And you can come forward and make any comment on anything you want to tell the commission other than things that are currently on the agenda for tonight. Now, nobody signed up early. Is there anyone in the audience that wishes to make a comment to the commission? You have 5 minutes, and please sign in and be sure to state your name and your address.
Sure. Should I do that first or after?
Just do it.
All right. Thank you. Yeah, all right. So, firstly, thank you all. I'm Advait Natarajan. I'm a junior at Manhattan High School, and I'm a co-leader of the Civic Engagement Group at the high school. And we hold a variety of events and opportunities for students and members of the community to come together and discuss various topics that pertain to the local community and also state and national and international issues. And we pride ourselves on following principles of civic discourse so that we can productively discuss these various topics in our community. And so, we come to you all today to share a project we held last month on MLK Day. And what we did was we invited various members of the community for a public discussion, community conversation on the topic of food insecurity in Riley County. And as some of you guys may know, food insecurity is a big issue here in Manhattan, Kansas. We are one of the top counties in terms of percentage of residents who are food insecure, and so it's a very community pertaining topic. And our discussion surrounded 3 specific, spheres. One was accessibility, another was improving nutritional value and quality of the food that we're providing. And then lastly, we focused on the system of food itself in the county and statewide as well. And so now I'll pass it off to my other co-leader to share the specifics.
Hello, my name is Raisa Hossein. I am also one of the co-presidents of the Civic Engagement Club at Manhattan High School, and I am also a junior. First of all, I am so thankful for this opportunity to be able to present our findings. I would like to clarify that we are not experts on the topic of food insecurity. Our platform mainly aimed to bring together prominent leaders in the community and people who want to get involved with their community to share how they feel about food insecurity and what they think can be done. So I'd like to direct your attention to page 1 of the action plan, where we can see that even though it was a very snowy day, we had a great turnout of 22 participants that represented over 19 organizations. At the top of the page, you will see common ground actions for all groups, which are basically different actions that the groups thought were important and needed to be implemented within our community. At the bottom of the page, after each group's final top 5, you can see their proposed action plans based off of the actions that they found common ground on. A big action that most of our groups thought were very important were collaboration within community organizations. We saw that a lot of people were expressing a need for a collaboration between the city and other programs, such as the Flint Hills Bread Basket and the Riley County and City of Manhattan Food and Farm Council. And we understand that there are already some connections in place, but we all agreed that overall there needs to be more collaboration in order to lower that percentage of our population that deals with food insecurity, specifically collaborating with the Manhattan Mercury and even the Manhattan High School Mentor to advertise and spread awareness about numerous programs that are already in place, because our city is a beautiful city that has programs in place, that has the resources in place. We just need to foster those collaborations so that they reach as many people as possible. So that was an overarching theme of our conversation, just spreading information. For example, in Action G, you can see that our participants felt that there needs to be a need to encourage local businesses to be transparent about where their food comes from, what's in their food, to provide more information. Another big theme was transportation and allowing people to have access to the groceries and the fresh foods that they need. For example, we saw that there was a need for a potential look at rezoning our city so that there's more access to grocery stores, because the middle of Manhattan is currently experiencing a food desert where the nearest grocery store is on like the clear other side of town. And also providing food that meets everyone's needs. I know that our Flint Hills Bread Basket already provides food that is halal, kosher, and supports everyone's different nutritional needs, but there is always more that can be done, and we at Manhattan High School see that, and we want to collaborate with the city and other organizations to make change possible. Thank you.
Okay, thank you, and appreciate the report, and I'm sure everyone on the commission will read it. Is there anyone else that would like to make public comment tonight? Okay, seeing no one, we'll close public comment and move to commissioner comments.
I originally didn't have any commissioner comments, but I do now, because I want to thank the MHS Civic Engagement Group for coming and appreciate the work that they've done. I know Riza in particular, and been on a couple of committees and groups with her, and she's a very engaged young person, and I just want to say, keep it up.
Thank you so much. Thank you for your time.
Thanks for presenting to us. It's good to see young folks getting involved in the community early on. I think that's really important for us. And I just want to give another shout out to Public Works and road crews that have been out. I think we reported we put out over 300,000 pounds of patch asphalt in the month of January. So really that's the last 2 weeks of January. So that's a ton of work, and definitely noticeable today driving around. So thank you for that.
The Community Mental Health Task Force, which has been meeting for about 12 years, is going to segue into more of an overall mental health group, and we'll be meeting monthly with many of the same providers that we have been working with. The Pawnee is going to move into a new echelon of care, and we're looking at ways that we can be more supportive. We've had great success with the stabilization unit, the sober house, the ability to get assistance more quickly, but we still have major issues going on and people spending way too much time in the ER because we don't have placement for those individuals. So that's just going to change a little bit, but it'll still be happening.
I was able to attend the event on Martin Luther King Day, and I just, again, also want to add my commendation to the students. It was very well organized, and as you can see, very well attended with many of the organizations that support our social services network in Manhattan. The same club, also, you may recall, also assisted with one of the candidate forums this past summer. And so, again, as Peter said, it's great to see young people taking an interest in this.
Okay, I just want to echo Peter's comments. I appreciate the work Public Works has done to get all those potholes filled. I think there was like 500 and some just done yesterday. So quite a feat, and of course, there's gonna be more cropping up. So those of you out there that find them like I do, use the Reported app. And then that way it'll get prioritized because the street crews aren't out looking for them, they're trying to fill them. So appreciate any help in reporting where those things are. Okay, we'll move on to the consent agenda. Items on the consent agenda are those of a routine and housekeeping nature, are those items which have previously been reviewed by the city commission and may be approved in one motion. The commissioner may request an item be removed for separate discussion and considered immediately following the consent agenda. Comment from the public related to any item on the consent agenda to the city commission is allowed. Each person will be limited to one speaking opportunity for up to 5 minutes. So, are there any items the commissioners want to move?
Item F.
Item F, which is the resolution, okay? We'll take it up on the general agenda immediately after the consent agenda. Any other discussion? Okay, is there anyone in the public that wishes to comment on the consent agenda items? Okay, and seeing none, we can entertain a motion to approve the consent agenda except for item F, which we'll take up as part of the general agenda.
I move that we approve the consent agenda except for item F.
Second.
Okay, we have a motion and a second. Please call the roll.
Commissioner Adamchak,
Yes, I concur.
Commissioner McCullough,
Yes?
Commissioner Opelt,
Yes.
Commissioner Motta,
Yes.
Mayor Butler.
Yes. Okay, then we'll move
Motion-
on.
Motion carries 5-0.
Then we'll move on to the one item F, which was removed from the consent agenda. And item F is a resolution, which is approve a resolution declaring support for Medicaid expansion in the state of Kansas.
Okay, we talked about this before in the work session. At that time, I mentioned how when we went over our legislative priorities, I had made a comment that I thought we should stay away from, partisan Topeka issues and should really stick to issues that pertain directly to us as a city. I don't know if I mentioned it at the work session, but I actually mentioned Medicaid expansion as one of the items not to take a look at because it was so partisan at that time. But sure enough, that's where we're at today. It's interesting that there's finally an issue me and Ned Seaton agree on. So anyway, when I talk about issues that directly relate to the city to be involved in and take on legislative positions, I have them like in 3 categories. Home rule issues, things like zoning, which now there's some things in the legislature that want to say we can't rezone something unless a citizen wants to rezone. And there's a lot of other things that they could possibly bring up. Election rules, which are some of the things they're looking at, like ranked choice voting, which I don't believe in ranked choice voting, but I don't want them to tell us what we can do and not do. That should be our decision to make. Or adding party affiliation, which I know we gave some legislative testimony, which is interesting because our testimony is that, we're involved in nonpartisan issues, but now we're involved in a partisan issue coming up. And then, of course, there was the elected sheriff that, we gave our opinion on. The others are things that affect city funding source, things like that Genesis bill that's out there that wants to make it so we can't tax them because we have a rec center and they have a club, or there's a bill there for exemption for property taxes for disabled veterans. I know the county spoke up against that. I know they're going to amend that so that they reimburse the counties and the cities. I say, don't take the tax money, give them a rebate directly from state funds so that it never comes out if that's what you want to do. The other is pertaining to a significant city industry that we might want to advocate for. Actually, 2 of our biggest are actually government things, which is Kansas State University and Fort Riley, which will directly affect us. But what I don't have on this list is Medicaid expansion. Or I wouldn't bring up a flat tax, which is something I think would be nice within that bill. There's even a child care tax credit to go along with it. But I don't think that's something we should get involved in and should be debating. I would think probably a lot of commissioners here wouldn't agree with me on that one. Not positive, but I wouldn't bring it up to the body to try to pass a resolution to do it. You know, should we take up flat tax? Should we take up, should we get involved in federal issues and get a position on Gaza? I mean, what are the things that we want to take positions? I mean, things like the potholes, that's what, in zoning may not be sexiest of items, but that's really our charter and here and what we're supposed to take care of. I know we hear from lobbyists who say, this thing will pass if leadership just won't let it pass. Well, I talked to other lobbyists who actually, from the other side, who don't really concur with that. Now, I said at that work session that I would present some of the arguments against Medicaid expansion. I really don't want to do that, but I am going to do it because I said I was. Because I don't want to, because I don't really think we should be debating it. That's really my argument in the first place, given what I just said. So I'll go through with my 4 pages. And then, of course, I'll hear of why it's a great idea. And then we'll vote on something that really isn't our purview. So here's my 4 pages. It will cost more than projected. On average, costs per enrollee of Medicaid expansion are 64% higher than projected. More people will enroll than projected. Expansion states predicted 6.5 million people would enroll, but 16.7 million did, 100% more than projected. It will cause people to lose their current health insurance. If you like your health plan, you can't keep it. As the Foundation of Government Accountability explains, when states choose to expand Medicaid, able-bodied adults with incomes between 100 and 138% of the federal poverty level become eligible for Medicaid, automatically lose their ACA insurance, private insurance. It will crowd out health care for children. A 2022 Maricast study found that between 2014 and 19, expansion short-changed children in expansion states by about 500 per child on average over the period compared to non-expansion states, because it shifted those resources to adults and away from children. It will open up the door to massive increases. And one of the ways it does that is there's only limited people that will take Medicaid. And so then you have adults in the system. So a lot of the current people in Medicaid, including a lot of children, end up not being able to get appointments or get doctors or things of that nature. It will open the door to massive increases in fraudulent and improper payments. A 2020 Federal Medicaid Agency estimation that $1 in $5 spent on Medicaid was an improper payment, a loss of $86 billion in that fiscal year alone. Most of those improper payments come from paying for people who aren't eligible for the program. As of today, more than 10 million enrollees nationwide are not actually eligible for Medicaid. It won't prevent hospital closures. Arkansas expanded Medicaid based on promises of higher revenue for struggling hospitals that would enable them to keep their doors open. The promises proved false. It will crowd out private insurance. Most people eligible for expansion are already eligible for private insurance. Expansion merely crowds out private options, hurting doctors, hospitals, and financially drawing people into a broken healthcare plan that won't be there when you need it. After Kentucky expanded, its hospital association reported that 1 in 5 Medicaid patients seeking treatment at their hospitals actually had private insurance when they enrolled. In North Carolina, 63% of potential expansion enrollees already have private health insurance. It will increase the enrollment in traditional Medicaid, costing states beyond what they budgeted for. Many who sign up for expansion are already eligible for regular Medicaid. They cost the state more than expansion enrollees do. States see what they call a woodwork effect of about 10%, meaning a 10% rise in traditional Medicaid enrollee population above the anticipated enrollment rate. Woodwork enrollees cost the state more than expansion enrollees, but they come with a lower federal contribution. Projection of expansion costs often fail to account for this. Health and Human Service audits continue to uncover state misclassification, enrollees as part of expansion population, rather than part of the traditional population. This means many states are underpaying for Medicaid. If forced to comply with federal law, they will have to fill a budget hole. It will increase emergency room overcrowding. Emergency department wait times increased 10% in states that expanded coverage compared to states that didn't. The hospital emergency room is the most expensive outpatient care setting, but for Medicare patients, it's free. They incur no out-of-pocket cost or debt when they waste ER resources on non-emergencies. To be fair to Medicaid enrollees, many have few good alternatives to the ER because low payment rates cause physicians to shun them. On average, Medicaid pays only about 25% of what private commercial insurance pay for the same service. Medicaid patients are 1.6 times less likely than privately insured patients to successfully schedule a primary care appointment and 3.3 times more likely to successfully schedule a specialist appointment. And Medicaid patients wait longer for appointments than privately insured patients. An HHS investigation found only half of doctors listed as insurers as accepting new patients were actually accepting new Medicaid patients, and 25% of Medicaid patients with appointments had to wait over a month to be seen. Medicaid recipients receive lower quality care. The strongest randomized control studies show health outcomes for Medicaid enrollees are consistently worse than health outcomes for privately insured or even uninsured. Quality in state Medicaid programs is so abysmal that some Medicaid recipients have sued their state governments over it. A group of Medicaid recipients in California lodged civil rights suits against the state over substandard care they received. Despite this pressure, the state is still struggling with its Medicaid health plans. It's financially risky. States can easily be forced to shoulder more of the cost. Congress could alter its financial contribution to Medicaid, shifting more of the cost onto states. D.C. could require states to correct erroneous enrollee classifications, increasing state cost. And with $34 trillion in debt, they're going to have to find a way to cut their cost. This is one of the best ways they can push it down. D.C. can crack down on states using provider fees to fund their share of Medicaid funding. While there are currently limits on this practice, the federal government could certainly go further if it chose, leaving states scrambling to find additional resources. It is not hypothetical. There's legislation today be considered, or it's considered regularly by Congress. It's wasteful. Expansion enriches Medicare insurers, but little of the money goes directly to benefit patients. Only 20 to 40 cents of each Medicaid dollar directly improves recipient welfare. Yet we consistently see reporting of massive profits of Medicaid managed care organizations, private insurers that provide health plans to Medicaid enrollees. For example, from 2014 to 16, Anthem made a profit of $549 million from California Medicaid plans. Yet during that time, 8 of the 12 Medicaid health plans received low scores for patient care, and the company only spent 77% of its money received from the state on medical care. It's all or nothing. Once the state expands Medicaid, there's no going back. No state has rescinded expansion to date for the simple reason there's no politically realistic way to do so. A state that wanted to pull out would have to disenroll its entire expansion population cold turkey. There's no provision for a phase-out or off-ramp. There's no way to trim or limit expansion enrollment if costs spiral out of control. Federal officials will not let states cap enrollment or reduce eligibility below statutory income thresholds. States like Ohio and Arkansas have sought relief but have been unsuccessful at reducing or reforming the expansion program. States have not been able to successfully implement a work requirement for enrollment in Medicaid expansion after numerous legal challenges. In fact, one of the things going on in Topeka is the governor willing to take a work requirement, which she might as well, because many states have tried to put it in. None can get one in. The feds simply won't let it. So that'll be an easy concession to give up. So that's pretty much the end. It's only a 3 1/4 page, but I just say there's more efficient ways to do this. Get low-income individuals with health care, such as tax credits, and also providing incentives for doctors and other healthcare professionals to work in areas that don't have the needed capacity. Because one of the things that's going to happen is you're going to have a lot of doctors who will not take Medicaid, a lot that are going to really limit their practices, and the people who are on Medicaid are going to have less and less ability to get appointments and to use their physicians. So I think it's flaws. I think it's going to cost us a ton of money, and I think it's going to cost even more as it goes on. And the regulations, and also just the administrative of it. Mercury had an article today in the paper, which actually I read because the Mercury tends to just copy a lot of articles from one news source to another, talking about how terrible the administration is with Kansas. There's probably, they said, like 100,000 people that maybe should be on, but we're not sure just because of the bureaucratic incompetence within the system that we have today. But the bottom line is, I really don't want to debate it, because we shouldn't be debated, because it's not our purview to do it. And it puts us right in the middle of all this state politics versus working on the issues that we should be working on, that we're elected to because we're city commissioners. We're not state legislature people. And I think we should only address those that directly affect us. And some people say, well, this directly affects the citizen, even though it's not an income stream directly into the city. Like I said, let's do the flat tax then. I think that'll affect more people within the community than this Medicaid expansion's going to be. But I wouldn't bring that up.
John, would you mind sharing with us the sources of your information?
Maybe, because I don't want to debate it to begin with. Will you share me all your sources?
Yeah.
But see, this is just it. I don't want to spend any time on this. I want to
Excuse
spend the
me.
time on city business.
Excuse me, this is city business.
You asked me
On
a
our
question.
agenda. It's on our agenda. And I can cite the Alliance for a Healthy Kansas, which has calculated the impact of Medicaid expansion for every single county in the state. For Riley County, I'm sorry, I don't have details for Manhattan specifically, but we know very well that medical services in Riley County are hugely concentrated here in Manhattan. Riley County has approximately 2,640 uninsured residents who would be eligible for CanCare if it were expanded. It's estimated that 879 new jobs would be created in Riley County. That's economic development. It's also estimated that there could be as much as $22 million in new annual health care spending in Riley County. I mentioned in a previous meeting that I've been involved with some very low-income families, low-income families who work for the school district. They make approximately $16 an hour. If you do the math, that comes out to around $30,000 per year. Take out the taxes, take out Social Security, their take-home pay is about $500 a week for families ranging from 6 to 10 people. That's not a lot to live on. It's not a lot for paying rent, maintaining an automobile in order to get to work, buying food, even using the food programs that are accessible that the students just told us about. Yes, most of the people that I'm aware of are working. They are eligible for insurance through the school district. If they take that insurance, they will still have a deductible of $2,500 for a person. For the dad, because most of the moms and the kids are already covered by CanCare. $2,500 deductible for someone making $500 a week is not going very far. I think it would do well to support. We talked at length a couple weeks ago about developing affordable housing for people in Manhattan. One reason that we do have uninsured is because they need that extra $50 that would be deducted from their salary in order to pay for food, in order to pay for other expenses. I'm sorry if you didn't want to debate this, but I think it's important for us to be aware of the decisions that we can help make that might improve the life circumstances of people in our community. And the reason this is a partisan issue, every poll I've seen cites that 70 to 80% of Kansans support Medicaid expansion. We know that Kansas is a Republican state, So there's a lot of Republicans who are in that pool of people who think we should expand it. It's being made a partisan issue by two leaders at the state level. Thank you.
So I'll leave all of my arguments that could refute most of yours. But what I will bring up is the legislative priorities for the city of Kansas since 2017 have included CanCare expansion and community mental health center funding. 2018, CanCare expansion. The city supports the expansion of state's Medicare program. Every year since 2017, with the exception of 2024, our city legislative priorities have included Medicare expansion. This year, it was not included in our legislative priority, and the reason we're bringing up this resolution to say that we support Medicaid expansion is because we were maybe advised to by one of our legislators, a Republican legislator nonetheless. So this is really no different to me than adding this to our legislative priority, which it has been since 2017. In general, our healthcare system is not broken. It is working exactly the way it is designed to, because we have for-profit entities working in our healthcare system, both the insurance companies and the major hospital systems. They have a fiduciary responsibility to increase value to their shareholders. Their responsibility is not to provide good quality care to Americans. So it's not broken. It works exactly the way that it's supposed to. I don't think that Medicare expansion is going to fix that, but it certainly is going to allow a lot of people at least the access to have health care in a country where I think over a third of our bankruptcy cases include some form of medical debt. People have no control over that. So this is at least a step that we can take to maybe help support those folks.
John, I do think you need to give us your sources. I mean, I could start spouting things like Kansas has gone from 8th to 21st in rankings in healthcare, and I know, having been on the mental health task force forever, we're 51st, which is more than most people think we have states, but we are worse than the Washington, D.C. Also, the article in the Mercury was about COVID people not being, that shouldn't be insured. It wasn't about Medicare particularly. The one thing, and I think Peter spoke well, when we met with our legislators, we talked about this subject, and I really had the feeling that they would like our support. They're the people who are representing our city and our county, and they really want to see this happen, Republicans and Democrats, on our legislative, who represent us in the legislature. So I think this is an act to support the people who we expect to go to Topeka and in turn support us.
Well, John, I agree that we shouldn't be deviling in things that are outside City Commission's lane. Generally, the problem I have with the Medicaid thing is Mike Dodson is our state representative, and he recommended that we do this to support his efforts in getting it passed. And of course, Mike was on the commission here for 4 years and was mayor, know him quite well, and he thinks it's a good idea. Now, I've also looked at, we got both sides of the argument there. John, you did a good job of, here's the bad parts. Then you read other people's things, good parts. I don't really care what the sources are. I'm not sure which one is correct. I don't think you know unless you implement it. And I do think, though, for sure it would help Pawnee Mental Health,
Yes.
which you've mentioned, Karen, which that one I think I can firmly say, yeah, that'll come out positive. I don't know about the ER. My wife thought it might help, but she worked there for 44 years as an ER nurse. So, she talked to me about that. So she's in that camp. So that's where we are. I think we do have to be careful about getting involved in these things. But all we're really doing here tonight, and this will pass because we knew that before we put it on the agenda, because 3 of the commissioners were solid for it. And But it's just a document. It really does nothing except give Mike Dodson some cover when he tries to get them to vote on it up there. And they'll end up making the decision at the state. And so I'm going to go ahead and support it for two reasons. You know, one, I think it might help Pawnee mental health. I also think that I want to support Mike Dodson and our legislators because all of them wanted this. But I also firmly believe John is 100% correct that we want to stay out of these whenever it's possible. Because it
Mike's also, so that veterans thing you were too keen on.
Yep, that's correct. Now, is there anyone in the public that would like to comment on this particular item? If so, you can come up and sign in. You have 5 minutes. Okay, seeing no one for public comment, we'll take this back and close it up with a vote, I think.
Yeah, I would move to approve resolution number 020624-A, declaring support for Medicaid expansion in the state of Kansas.
Second?
Okay, we have a motion and a second. Please call the roll.
Commissioner McCullough,
Yes.
Commissioner Opelt,
Yes.
Commissioner Motta,
No.
Mayor Butler,
Yes.
Commissioner Adamchak.
Yes.
Motion carries 4-1.
Okay, the next item on the agenda for tonight is a public hearing. And
Okay. Oh, thank you. I can't see. Oh, and I got on
so
contact.
this is a public hearing to consider levying special assessments.
Yes, sir. Okay. Good evening, Mayor and Commissioners. Rena Neal, Director of Finance. Background, the city sells bonds twice a year, normally May and November. During the May series, we try to include all of our special assessment projects, and we'll have some capital projects later on. We have 13 projects in this May 2024 series. All the benefit districts were established by petition and a resolution. On January 16th, the City Commission set tonight as the date to hold the public hearing. All property owners were notified by letter about the amount and purpose of their assessment, and the notice of public hearing was published in the Mercury. Public hearing purpose, to hear questions or objections from property owners concerning their assessments. We have, as of the date of this PowerPoint, there were no calls, but I have received about 5 calls, just inquiring about their assessments, what the estimated amount would be, and then there were some concerns, and some of those people may be here this evening, just questioning why the addition to their special assessments to their property. Here is some cost information for those 13 improvements. So the total project cost, $7.368 million. Of that, $5.981 is related to the benefit district, so the property owners would be responsible for that. And then $1.386 is related to the city at large, and there's various funding mechanisms for the city at large portion. Here's a map of all of the property areas impacted. So we have K-State Research Park, Meadowlark Hills area with that commercial development, Northview Acres addition with that storm drainage improvement, and then Scenic Crossing and Stonehaven. So the first set of information regarding those improvements are related to K-State Research Park Unit 4, and there is a typo. One of the lots was replatted to be K-State Research Park Unit 5, Lot 1, but the special assessments are still the same for all of those lots, and they're estimated around $29,800 a year for each of those lots for 20 years. Scenic Crossing Unit 4 has various units and lots within those, and it was easier to break it down this way than to list all 30 plus lots. So for if there's a lot that's single family, unattached, the estimated special assessments is $1,253.70. And those properties do have special assessments already on from the first phase of Scenic Crossing. Then we have Unit 1, Lot 29, and their share, and Lot 30. And then there's some townhomes, lots 21A through 27B, and those, the per lot amount for those are $518.86. And then Unit 3 has 2 lots, and that's the per lot amount for those. And then Unit 4 has 4 lots with the per lot amount for those lots. Smith Channel, Northview Acres Edition, there's 8 lots between that first edition and number 2, and they vary, but those are the amounts listed for each of those lots on an annual basis. Stonehaven has quite a few assessments. We bonded 3 of them last year, and then here's an additional 5, and they just vary based on the petitions from the developer. And so we have a street improvement, a detention pond, another storm drainage improvement, lift station, and then the roundabout. And then we, the city of Manhattan, we own a lot, Tract B, and we anticipate paying for our share of the special assessments from the bond and interest fund, the stormwater fund, and the sewer fund, wastewater fund. But each lot is listed and their estimated annual amount. And that would be in addition to whatever they currently have on their property taxes for special assessments. And here's the next set. And here are the maps related to Stonehaven Edition. And then the last set of improvements is related to the Meadowlark entrance and US 24 left turn frontage road. And we have Meadowlark Hills Retirement Community, and then the Blue Hill Shopping Center properties, so Dollar General, RLD, and then Dara's. And those are the estimated annual assessments for those 4 lots. KDOT did contribute to this portion of the project, and that was taken into account prior to these assessments being divvied out. Next steps, approve the special assessment ordinance on February 20th. So the first review of that is in your packet this evening. Property owners will receive a second letter after that meeting on the 20th, and then they will have until March 22nd to pay their assessment amount. They can pay it on a per project basis, 2 projects, all projects, if they would like. If not paid, the assessments will be bonded in May of this year and amortized over 20 years. We will sell the bonds on May 16th, and then assessments will appear on the November 2024 tax statements. And that concludes my presentation, and I'm open to questions either from you all or from opening up the public hearing, sir.
Okay, we'll open up the public hearing. Is there anyone in the audience that wishes to speak on any one of these? Okay, doesn't appear as though anyone wishes to comment, so we'll close the public hearing. Does commissioners have any comments?
Yeah, Rena, I'm curious, how did you figure out the different assessments for the different lots?
Okay, so the developer submits a petition, and in that petition, there is a description of the project, the lots that are impacted, and then the method of assessment. And then we have how much would be apportioned to the city, and then the benefit district. So I have to go back and look at all the resolutions and then apply that to the final cost, and I have spreadsheets to do that, but it's on a detailed basis based on every resolution for these particular improvements. So if you look at the ordinance, it'll tell you which resolution corresponds to each particular project.
Okay.
And then the resolution will then say how much is supposed to go to each lot, if it's an equal share per lot, if it's square footage basis, like with Scenic Crossing. I'll show you real quick. They had a percentage that went to Unit 1, lots 1 through 20, and then they had their own percentage. Each of these segments have their own percentage. Let's see, those had probably square footage, I don't remember off the top of my head. And then the same with Stonehaven, they had percentage shares based on square footage, and then so did this frontage road project.
And when say a homeowner buys a property in the development, I know generally like any special assessments that are applied to the property are usually declared, hopefully before closing, but certainly at that time. Is there the potential for further special assessments included in that, or is it just because we've got like some stormwater projects and stuff like that that maybe we weren't anticipated when the development was made?
So when property is sold, there should be the disclosure to the property owner or the potential buyer that there are special assessments that are currently on the property. If there are future assessments that are going to be on their property, the title work with and finding out through the Register of Deeds should show that additional resolutions are on the property. It won't tell the amount,
Right.
but then that gives either the buyer or the realtor the notion that they need to contact the city of Manhattan,
Sure.
do further research, and then we will provide the estimated special assessments. And so I don't really deal with the development side. That is a CD/Public Works question in terms of knowing about future development and when that would come on. Like with Scenic Crossing, those first special assessments were petitioned around 2015 or 16, and then in 2019 is when this second phase came about. And so we issue our temporary notes for up to about 3.5 years. So there's just a lag sometimes in terms of when the special assessments actually go on the property compared to when the property owner purchases, and that timeline of communication. And then depending on when they actually bought the property and when the petitions were submitted, then there could be some communication breakdown or timeline. And that is really, it's not finance or any department within the city of Manhattan that is aware of that transition in terms of ownership of property. But if there is that, realtor should be contacting the city to assist their potential buyers with that, finding out that information.
Okay, thank you.
Any other comments from the commission? No. Okay, we've closed the public hearing, so I guess we can move to the second part of this, which is approve first reading. So can we have a motion on that?
Go ahead.
I move that we approve the first reading of the levying special assessment.
GOB.
Oh, GOB 2024A.
Right. Oh, second?
Do we need to read this entire thing? We do.
Yes.
Okay, so let me redo the motion here. And it's to approve first reading of an ordinance levying special assessments against the benefiting properties in the following 13 public improvement districts: K-State Research Park, Unit 4, Sanitary Sewer, SS 2006, Street, ST 2003, and Water, WA 2007. Scenic Crossing, Unit 4, Sanitary Sewer, SS 1922, Street, ST 1917, and Water, WA 1922. Stonehaven, Addition Unit 2, Amherst Street, ST 1903, Stormwater, SM 1903, Stormwater Quality, SM 1904, Sanitary Sewer, Lift Station, SS 1914, and Roundabout, ST 1904. Smith Channel, Storm Sewer Improvements, SM 1806, and Meadowlark Entrance and US 24 Left Turn Lane Frontage Road Transportation Improvements, ST 2110.
I move that we consider levying special assessments for GOB 2024.
We just need you to second.
I'll second it at this point.
I second.
Good, you're good.
I read the book.
Sorry, I second.
Okay, we have a motion and a second. Can we call the roll?
Commissioner O'Connell?
Yes.
Commissioner Motta?
Yes.
Mayor Butler?
Yes.
Commissioner Adamchak?
Do I say yes? Yes.
Commissioner McCullough?
Yes.
Motion carries 5-0.
Okay, excellent. We'll move on to the general agenda. And again, we can have public comment on the general agenda items as they come up. And the first topic is first reading of an ordinance regarding parking within the downtown parking garage, discuss the purchase and installation of equipment in the downtown parking garage, and discuss parking rates for the downtown and Aggieville parking garages. And I guess, Adrian, you take it from there.
Hi, can you hear me okay?
Yes, I'm good.
Hi, my name is Adrienne Tucker. I'm the Parking Services Manager for the City of Manhattan. Thank you to the Commissioners and Mayor Butler for allowing me to speak today. Again, we're revisiting the downtown garage tonight. Just as some background on the garage, it was built in 2010. It currently has 450 stalls, and parking is complimentary. The average occupancy rate of the garage is about 50%, which mostly consists of convention center attendees, attendees of events that happen at Blue Earth Plaza in downtown, and Hilton Garden Inn guests. Currently, it says 13 security cameras. At the time that this PowerPoint presentation was put together, we only had 13 security cameras. 5 were down. We've got 4 back up. There were network issues with the cameras. 4 are back up and 1 has been replaced. So we have a total of 18 cameras in the garage. Recent expenses last year that we had relating to the downtown garage maintenance and cleaning, we had to replace all of the exit emergency signs, which cost $10,695. Because the garage was not power washed or cleaned or degreased in the 12 years since it had been built, it cost $26,538 to do so. A lot of that had to do with reclaiming the water that was used and inadequate drainage of water into our stormwater system. It included mold remediation, stairwell cleaning, insect and nest removal, and window cleaning. We've had multiple broken windows that are now repaired in the garage that cost $2,885. And the upgrade to our camera system that is currently in progress in the garage is $43,891. When I came to the commission last October, that initial estimate was $100,000. I was able to find a contractor who supplied the security cameras that we currently use and that we need that can tie into our current system for significantly less than what I was originally being quoted last year for the same work. Currently, because we have no revenue sources going towards the downtown garage, these expenses are being subsidized by our general fund. In May of 2022, Walker Consultants did a condition survey at my request of the downtown garage because I had noticed some work that needed to be done on the garage and some repair work, and I was concerned about the overall condition of the garage. The following recommendations they made were sealant and waterproofing replacement, which you can see clearly is coming up in the garage. The precast concrete repair, facade sealant replacement, concrete and stone cladding repair, recoating of stair tower components. They are currently rusting out. We asked McCown Gordon to review Walker's report, and they found additional repairs, including replacement of all the bollards, removal of the outdated and unused parking equipment, and repairs to precast concrete T-flange deterioration at select locations. These are 2 examples of what we're talking about in terms of stone cladding that needs to be repaired or replaced. What you see here is pretty prevalent throughout the garage. The picture on the left is in reference to the T-flange repair work that needs to be done. So the garage is what we call a precast construction, where individual pieces of the garage are made beforehand and they're brought on site and put together, kind of like Legos, if you will. It's used as a reference. And this is the T-flange it's kind of like a large expansion joint that goes over the parking decks that you can see are put in place, and then the decks are built on top of, and they're starting to crack in certain places. And then again, just more of the stone cladding that's just coming off the side of the building. The reason for that is whoever installed it did not put joints in any of the stonework throughout the entire garage. So as the garage bends and flexes, that stonework is cracking and it's falling off the building because there's nothing that allows it to flex with it. It's just stone and caulking slapped up against the side of the building. The total cost of the repairs in the Walker report is $872,500 over 5 years. Routine maintenance and power washing, restriping, and inspections of the fire and life safety systems, which are required by law, will cost about $12,000 annually. Again, we have 18 cameras in the downtown garage compared to our Aggieville garage, which has 64. Our cameras and the system that we have in the Aggieville garage is well used by RCPD anytime that there's an issue either in the garage, which it's only happened like twice, or around the garage on the street in Laramie, North Manhattan. We can see at the entrance of North Manhattan and Morrow issues coming out of dirty dogs on a Friday or Saturday night. Anytime the police will reach out to us and ask for video footage because our security cameras are pretty detailed. We want to install a similar system, or we are installing a similar system in the downtown garage, and at the cost of $43,891. I also wanted to give an Aggieville garage update to remind everybody for the first 2 hours of parking in the garage are free. It's $2 every hour after for a daily max of 10. We offer employee permits at $40 a month for full-time. We dropped our part-time employee permits down to $10 a month, and we've seen a bump in purchases of the part-time permits. As more part-time employees are finding out about them, they're starting to purchase them and park in the garage. We offer a daily reserved rate of $100 a month and a 24-hour reserve stall at $200 a month. And I do have the option of enforcing special event rates. That's not something I've done since we've opened the garage. We've had 51,275 total transactions in the garage. And you see our revenue hourly is a little over $59,000, permits $76,000. We've written $30,000 in citations. And in the Aggieville garage, we've written 10,138 warnings. Those warnings are for people who never registered with the LPR system, or they backed their vehicles in instead of pulling straight forward into a spot. It is our philosophy that we want to educate, not punish. So we offer these warnings to people to let them know, like, hey, you need to actually register your vehicle when you park. Here, this warning serves as like your education piece to inform you on how to do that. Same thing with making sure that they pull in to park versus backing into a stall. 37,016 vehicles have received complimentary parking since January 17th, 2022. The average length of stay for these parkers is about 25 minutes. And had we charged for that parking, we would have accrued another $148,064 in revenue, but that is revenue lost. We're seeing that a majority of the 2-hour visitor parking, again, under 30 minutes, they're people grabbing a quick bite or grabbing their food to go, grabbing a quick cup of coffee or donuts or something to that effect. We have paid out $12,908 in Park Mobile transaction fees. So the transaction fees are how Park Mobile makes their profit. They do not charge the city for their services. They do not charge the city for advertisement or signs or anything of that nature. It's just whenever somebody uses their app, they charge a 35-cent transaction fee. Most other municipalities and organizations charge the user for that fee. When we instituted Park Mobile, the commission at the time thought that it would be best that the city pay those transaction fees on behalf of the customer. So, which is why we have that expense. And credit card transaction fees have totaled $4,345. The last time I presented this information to the commission, there was some talk about revisiting Aggieville rates. So I just wanted to give you the information that we have and the numbers so that if that was a point of discussion that you had data to go along with that. We are proposing a rate structure for downtown for people to park in that garage. It doesn't say it here, but the last time we presented, we are keeping the rates the same as Aggieville. It was mentioned that they want the 2 hours free as well before the rate kicks in, which seemed to be a consensus of what everybody wanted at the time. So we're amendable to that as well. With a hotel guest rate of $10 a day, which mirrors what is already being charged for parking for hotel guests, and a conference rate of $5 a day, which seems to be about the state average for conference rate parking, and the reserve stall of $200 a month like we have in the Aggieville garage. Conference center rates in Kansas, you'll see I've listed the major ones in the state. They offer, or they charge on average between $5 to $20, most often being $5 per vehicle for conferences. They all use the Park Mobile app as well. I left off Salina and Junction City for parking conferences, or for conference center parking, because although they do have conference centers and sizable parking lots, they don't have garages, and you can't really compare surface parking to garage parking in terms of cost and maintenance and upkeep and what it costs to manage the two. So we estimate that with this parking structure, we'll bring in about $296,220 worth of revenue. The startup cost to do so, as I said, with Park Mobile, there are no startup costs. We would install 2 pay stations like we have in the Aggieville garage, the identical pay stations, and fixed LPR cameras at the entrance and exits, which would cost $63,414. We estimate a sign package of $23,950, but there's no additional monthly cost for us to add LPR to the garage. We already pay for the software and the monthly service, and there's no additional charge to bring this garage online. So those expenses will not increase. The annual costs, again, $872,500 over 5 years in deferred maintenance, $12,000 annually in preventative maintenance and upkeep. In addition, we would hire 1 additional full-time parking ambassador that, in addition to the garage, would also patrol other areas that we currently patrol as well, and 1 janitorial services position to help us keep that garage clean. Anticipated expenditures over the 5 years, that adds up to $1.4 million. Estimated revenue over the next 5 years with the proposed rate is $1.481 million. So we're only looking at a net revenue of $48,236. Granted, I realize that this number is kind of arbitrary, but our philosophy is the same here as it is with the Aggieville garage, and that we're not looking to make a profit. We're looking to break even and to cover our operating expenses and maintenance. This is not a cash cow. This is not a money maker. This is not something that, we're going to line our coffers with, so to speak. And these estimated expenses do not include all those unexpected expenses like we've seen over the last couple of years. 2 years ago, a water pipe burst in that garage, and it was a part of the fire sprinkler system, and I think a little over $12,000, I think, was spent repairing that. We have broken windows. We stuff pops up all the time that we end up having to spend money on to get replaced. And these do not include existing or shared expenses or personnel that we're already using from parking services, like our division as a whole. Should you choose not to want to charge for parking in the garage, we still need to find a way to cover these expenses to bring in some kind of revenue. We need at least $300,000 annually to cover the expenses, and without user fees, the city administration would recommend using the TGT tax revenue. Again, there's some discussion about that last time. We're open to that discussion again here tonight. And any other ideas that the commission has or opinions, we're very receptive and open to. But I wanted to bring back to the action items that we're here to talk about tonight. Again, approve the first reading of an ordinance amending Chapter 31, Article 3, Division 5 of the Code Ordinances for the City of Manhattan, establishing regulations and penalties for violations of the parking garage for parking within the downtown parking garage. Those ordinances that were written mirror the ones that are in Aggieville and that are currently enforced now. The LPR contract provide feedback and direction for city administration to bring forth a future agreement with the IPS group. I just spoke with them today. We do not need to draft a new agreement. We can add on to the existing one because I'd be purchasing the exact same equipment that we already have. So they do not require another agreement. But again, looking towards you to provide feedback on purchasing of that equipment. And to provide feedback and a direction as to what funding approach you would like us to take for that downtown garage. I also wanted to add, I extended the invitation last time, but if any commissioner would like to come down to our office and see how we operate and what we do on a daily basis, we're more than welcome to have you. If you would like to do a ride-along with one of our officers and see how the LPR equipment works in real time on the street, we're more than happy to have you and show you that as well. Questions?
Yeah, it's not regarding your action points, actually, and it's not really to you, it's really to anyone for city staff, and this is something that I get asked is, are there any other city assets being grossly not maintained due to no revenue source or any other reason?
Not to my knowledge.
Okay, because we were asked, and I know Susan brought up in the campaign, how did this happen? And now's your chance to find out how, but that's, things that come up because of this. And I know in the last one we had, it was like, well, there's no point going to the past. We need to fix it here, but citizens want accountability for what happened in the past. And the second question that goes along that lines is, have any corrective measures been put into place to make sure we don't have substandard construction work like you were explaining with the stone that they didn't put in there, so it just cracked because it couldn't flexibilities? How are we going to make sure that something like that doesn't happen again? Or have we put something in place to make sure that doesn't happen again?
So we have our standards of construction that our engineering department has. We don't do a lot of vertical construction, and that's where we typically contract with an architect to do that construction inspection. In this case, we contracted with the owners of the hotel to build that, and they hired that person.
If we were doing that today in the same, would we simply not go with the hotel person, or would our person do some inspecting, or that engineered standard is different today? Or?
We did have some of our code folks that were involved in different aspects of it. Obviously, that was the first garage that was built in that style, and obviously not a lot of expertise on that. In hindsight, we should have got somebody that to inspect it that had experience in that sort of construction. When K-State built theirs, it's a poured-in-place one, so that would be more traditional forming and that type of inspection.
The other thing that gets asked is, why wasn't there a revenue source, or why didn't you know? And you being the commission, of course, that went on a long time, multiple commissions that were there. And I remember early on, I was on the commission at some point during that point, and we argued to charge for parking, and we were pushed back by staff that, no, we don't want to do that because it just opened. We don't want to put that in. And I think one of the arguments that may have been very correct is no one would park in it if we did. But that's the other thing that's come up is there was a pre-warning, just all of a sudden we were in this situation.
Yeah, I would just say that, the plan all along was to charge for parking. That's why we put in the equipment to charge for it in the gates. And there was quite a bit of community pushback on charging for parking. And there was wanting to be a phase-in period, and there was also, the plan was to move a lot of the debt service of the conference center to property taxes, and that hasn't happened either. So that would have been a need for some of those revenues to, if you're not charging for parking, to have support from property taxes, and there was not majority support for any of that.
I think you were with me when we wanted to charge.
Commissioner, a couple steps that we've taken since the downtown garage. When we constructed the Aggieville garage, we brought on experts and Walker consultants with that design. They're experts in that vertical construction of parking garages. I know Walker is working with TJ and the Midtown folks on their garage. It's going to be connected to that hotel across where the Handy Corner is right now. And a big thing that we never had before was Adrian and parking professionals within our organization and the creation of this division, and having people with eyes on the garage 24/7 to monitor that upkeep, the maintenance, having that knowledge of how garages are constructed, how to keep those maintained over time. Those are the big things. And it really does get back to that lack of a revenue source, and it's why we did not want to provide 2-hour free parking in Aggieville, because we missed out on $148,000 in revenue that could go towards the maintenance of the Aggieville garage, and why we're trying to talk about the downtown garage and various funding sources so we can correct that now. But that is one of the good things that we can talk about right now, is that we have a very professional staff in the parking services division that is in both of these garages daily, monitoring these areas so we can make sure that they're safe, secure, and clean.
Well, that's good to hear. I just think we have to be on guard when we do another project that we don't have any expertise in, that we get something.
That's true, yes.
Well, the next one we won't own. Adrian, I had a question, and it's nice to meet you. I haven't met before, but thank you. So the 1.4 million in expenses over the next 5 years, does that include the 800,000 in deferred maintenance?
It does.
Okay. And have we looked at like other rate structures? Like, you know, you said most of the free parking was 25 minutes or less. So if we were to say, if your 30 minutes are free, and then maybe lower the rate to $1.50 or $1 an hour with a max of $10, have we looked at how that might affect things, like using previous park? I'm sure we can get all that great data from Park Mobile, I hope.
Yes, yes. We've had discussions, but the overall consensus up until now has been, it's 2 hours free and $2 an hour after. But I do think that we can make up a lot of that lost revenue with a simple rate structure, such as the first 30 minutes free and then charging after. Yeah.
And then I'm sure, like with the downtown garage, just implementing this in general, most of the people that use that garage are going to be paying the $10 a day or $5 for conferences. I know there are some events in Blue Earth Plaza and stuff like that people use the garage for, but unfortunately it is kind of not utilized as well as it could be, I think, for downtown parking.
Well, one of the reasons why when we first came, I believe it was in 2022, to establish my authority within city ordinances, and allowing me the ability to set an event rate would be for things like downtown. We have an event at Blue Earth Plaza. We know that it's a longer event. We don't want to have people end up paying $10 just to park in the garage. I can reduce that rate for them so that we can lower it to $4 for the event or $5 for the event or whatever it may be, so that they're not paying that full daily rate.
Okay.
So I do have that option and that flexibility to do
Sure.
so.
I think that'd be good to look into. I'm fine with, folks that are coming out of town and going to conferences, paying that $10, especially because most of the time if you're going to a conference, you're not paying for it anyway. So do you, and I think it makes sense to have the same structure at both parking garages. Have you considered like having it different at all?
So typically what you would do in terms of setting pricing for two different garages, they're in two different districts that serve two different clientele and have two different types of business. So you would never have the same rate structure for both. You set your rate structure based off of usage. That's how it's typically done in the industry, and that's standard practice. It was mentioned at the last commission meeting when we presented that the general consensus from the public was that they would want the rate structure to be the same.
Yeah, I think it makes sense, just avoid confusion. All right, thanks. I'd love to come and see your office, by the way.
Oh,
I'll reach out.
absolutely, yeah.
I just have a couple of questions. I really like the vines that are outside the downtown parking structure. However, several people have said to me that those are kind of like kudzu and are really attack the building. Have we thought at all about the impact of the foliage on the side of the building? I mean, I think they're very pretty, but
The foliage is a point of contention amongst the staff in my office. It is beautiful to look at, however, it is deteriorating the exterior of the structure.
yeah, I mean, it seems like maybe we better take it off if it's really,
And birds, lots and lots of birds nest in it. And so we're constantly spending money and time and effort removing bird matter from the parking garage, and it's very acidic and it's eating away at the concrete.
yeah.
And so
That's
it's,
what my people who know plants have told me, and they were just very surprised that we would have that kind of vine. I don't know, maybe they're better vines, but the other thing is a lot of times when I park in various parking structures in Kansas City or things like that, I can get my parking ticket validated. Do we do any of that? You know, the shop I'll buy X amount of, stuff, and they'll say, I can validate your parking.
we have the ability to do so. We have not had any businesses come to us wanting to offer validated parking for their clients, but we do have the ability to do so. We have the ability to, if you decide to set rates for the conference center or offer any sort of like complimentary parking, we have a way to generate codes that we can give people that they can use to validate their parking.
Good to know. Maybe we ought to look into that a little more.
Yeah, absolutely.
Yeah, like they were doing that at the, what did we have, the joint government meeting? Because K-State uses Park Mobile, and they sent us a code. It was supposed to cover it. It didn't happen to work that day.
Oh, no.
So maybe it'll work next time. But the system is there, and so I think it puts a lot of flexibility in there.
And I've already spoken with Park Mobile and the IPS Group, which is the company that we contracted our software for parking enforcement and permits and pay stations. And they can create one code that works for both the Park Mobile app and the pay stations. So anytime that there's a conference or a large event and there's a code that needs to go out, they can use it at either on their app or at the pay station, which is very handy because there are some that refuse to download apps on their phone and want to use the pay station or vice versa, and it's just easy to just have one code that they can use for their parking.
I was going to ask how many people use the pay stations. I figure it's mostly the app, but how many people use the pay stations?
We're at about 15% of people use the pay stations.
All right.
It was about 50-50 at first, and then over time you can see the numbers change.
I think once you figure it out, the app is really easy, and
Yes.
it's kind of nice. You don't have to, yeah.
Yeah.
Okay, any other comments from the commission? We'll open it up, public comment. I'm sure we have a few folks in the audience that would like to bring forth some ideas on this, so just come forward and state your name and sign in and let us know what your thoughts are. Won't start the clock till you get up there, Dennis.
Yeah, you're so nice to me. Wow. Good evening. Thank you for allowing me to be here. I'm Dennis Cook with the Aggieville Business Association, 1125 Morrow. Of course, we're all in favor of, we're thrilled we got the parking garage, but, but I would just say at this point, we're completely different than a parking garage downtown that is, connected to the conference center. We're, that parking garage was really needed for us for the redevelopment area that we're doing, and we're going to be losing, we keep losing some public lots to go to something like that. And I think our business district was really clear about, we're okay, but the 2 hour free is really vital to small businesses where you get a lot of, in and out versus coming in and staying for a while. And that would be a huge blow if we tried to change something like that. Now, we've kind of had we had a little bit of a storm for a while, people talking about that, and that's gone away. And I think, I'd love to see that. And I do recognize when Adrian put that up there, that you're, okay, well, you missed out on $150,000 worth of revenue. Well, but again, the idea is this is not supposed to be a moneymaker. What we're trying to do is stay as close to providing something that the community needs without detrimentally hurting those businesses that need that. And obviously we've got more construction coming, and so as Adrian and I just talked about, we're going to get together and we'll talk about what we're going to be losing here over the next, well, let's just make it easy, within the next 2 years. What we'll lose on Laramie, what we'll lose on 12th Street, what we'll lose in a private lot, that's the handy corner right now. So I guess, my point would just be, I think what you do with downtown, I would, you guys make those decisions, but I would hate for us to make any changes in the Aggieville parking structure pricing right now. That would be really, really difficult, and I think that would be a detriment to the district. Thank you.
Okay, thank you, Dennis.
Good evening, Brad Everett with the Hilton Garden Inn of Manhattan. I know there's interest in go ahead and underwrite the parking garage. I'm not here to go ahead and debate that. My concern is we have legal contracts that extend years out that we have with groups. I just had one recently that was just within the past week or two. And Parking Services was good to work with us, but they came in alarmed when they had about a dozen tickets, one of which was on a handicap car that she happened to lay her handicap sign on the front dash, but she still got ticketed. That being what it is, it still got taken care of. But the concern was they were going to pull their business. So we're picking up $5 or $10, but we're saying goodbye to $50,000. Doesn't make too much sense to me. We just expanded that conference center just a few years back during COVID, which we had lost millions of dollars. The community has invested a lot of money in that district. We still are investing a lot of money with the new museum and other amenities. We try to go ahead and provide something special for that area. The parking garage, we host, for example, a military luncheon with the chamber. That if we didn't have the 2 hour deal, they potentially would look somewhere else to go ahead and host it. Our guests are different versus Aggieville. We saw on the graph earlier that most of the folks that are down there come and go, and which is still sales tax revenue and still providing some alcohol revenue that the city certainly enjoys for projects throughout. But bottom line, if we're going to go ahead and put fees on there, what are we going to do about taking care of the agreements that we've had extended out years in the future? We're just going to tell them, sorry, and then we have to find some way of getting that resolved. Do we go to the CVB, or do we go ahead and truly provide passes, and then you end up falling short of your goal? And if we end up losing the revenue, we're not serving any good, but all we're doing is just covering the maintenance, for a garage. The garage has gotten better over the years with homeless and things of that nature. They've taken positive steps. Some of the bird-ish that's down there are on the new lighting. That is a platform for a lot of the birds to simply, that's inside. It is what it is. They're pigeons. They drive me crazy. I try to shoo them off. Some of it, as she's noted, are up there in the, whatever that is. It's a weed that goes up along the side of the garage. But again, I feel that if we're going to go ahead and provide some type of fee structure in there, my guests are staying overnight. My guests are staying more than what they are in the other parking garage. They're here for an extended basis, many for multiple days. They're an economic engine that provides a whole lot of money throughout this community. If it wasn't, then we wouldn't have built the conference center. So the money we do charge, just for the record, the $10 came out post-COVID, a few $1,000s a month, if that. I opposed it, just for the record, in case Rick sees the video of the owner. I think there are better ways to go ahead and garnish money, but he is the owner, wants to go ahead and pick some of that. Those additional dollars up to help with the P&L. That's his choice. It's his owner. It's his hotel to do as he chooses. But I'm dealing with the guest. I'm dealing with people that if they're irritated, I waive it. If they're conference goers, they're not paying it. So the amount of business that's actually getting charged at from my hotel is minuscule. The volumes that we get in, millions of dollars we generate down there, it's a handful of folks that are getting billed. So I think we need to be careful and deliberate on what we're doing, that we're not saying goodbye to thousands, well, tens of thousands and hundreds of thousands of dollars potentially of business. It will not make a good situation with the ownership of the city. I can tell you that, in my opinion. Thank you.
Normally, we don't ask questions. I want to ask one, Brad, that just to clarify, because this come up constantly. The $10 that your owner is charging. If I register at the hotel, I pay $10 to park for my room, but that doesn't come to the city.
No, it doesn't. But the sales tax we generate does.
Okay, but that's the bone of contention. Like, the parking garage belongs to the city, but the owner's charging people $10 to park in there, and he's pocketing that money.
He is. Just like he is with the pantry there and other amenities he offers with breakfast and evening drinks and meeting room rental.
Just
I
wanted
get
to
it.
be sure that was.
No, I get it. But the bottom line, if you're going to go in and pick a few dollars here and there, when you look at the full thing, you want to say goodbye to 50,000 or a couple meetings and say goodbye to six figures, then, that's another thing strongly to consider.
Okay, thanks, Brad. I
You bet.
appreciate it.
Anything else? All right.
Some other things. Anyone else want to make? Seeing none, then we'll close public comment and come back to the commission. If we could put that slide back up there that's got the 3 action items, that'd be helpful, because the only ordinance we're going to vote on, it's not going to establish any fees down there.
Correct.
That first thing is just basically going to say the parking rules and regulations, so they can be enforced, will take place, and then eventually, we'll give feedback on number 3. So I think the first one's pretty clear. What we're basically saying here is, if you don't park correctly down there, you can get a citation, and that's all that's about, right?
In addition to, what I think is the most important piece is that it prevents what's called camping in the garage. So you cannot park your car there and camp out of it. You cannot live out of your car in the garage. And because we all know that causes problems, and that's something that we are currently having to navigate without an ordinance, which is difficult to do.
Okay, so you'll have, you can go through there and read license plates, but since we won't have Park Mobile in place, you would only cite somebody if they were there over 24 hours and not a hotel guest, or?
The ordinance doesn't necessarily spell the downtown garage parking regulations out from that standpoint. We do have a citywide ordinance about 48 hours parking in the same spot that would be enforceable in the garage. This ordinance, if you recall, last year or in 2022, we passed the Aggieville Garage Ordinance. This one kind of changes that ordinance and relates to all city-operated garages. So part of the ordinance deals specifically with the Aggieville Garage. Part of the ordinance deals with just prohibited behavior, which is what Adrian was referring to, so that RCPD is able to cite offenses and mitigate those circumstances in the garage, that prohibited behavior is there. It calls out that related to parking fees, the city commission would adopt a resolution if they want to charge parking fees. If there is no resolution, then no fees would exist, which is where we would be at today. So if you guys pass this ordinance tonight, there wouldn't be any fees. We would come back based on item number 3 with a resolution to call out some of those things. It talks about LPR in the ordinance, but that's only related to the Aggieville Garage right now because we're not enforcing any of those parking rates or anything like that.
Okay, that's a good clarification, because what I'd like to do is take these in 3 chunks and just go ahead and vote, get rid of one, and then we can talk about the other ones, which is the devil in the details.
Yeah, so when I read through this, I kind of assumed that this was, the ordinance would be applied the same way across both garages. And then I read, the parking fees section, and I guess I kind of assumed that the parking fees section would apply to both garages. But what you're saying is like, it just, because I mean, the section just says parking fees for parking on or within a garage shall be set by a governing body resolution.
Yeah, so
it doesn't say that they have to be exactly the same, right?
Mm-hmm. Okay. So back in 22, when you all passed this ordinance, we then came back and we purchased the LPR equipment for the Aggieville Garage, and you all approved a resolution that is specific to set rates in the Aggieville Garage, and then it also calls out Adrian's authority as a parking services manager to set the permits and other types of fees. So depending on your feedback related to Aggieville, we could be redoing that resolution. We'd also, depending on however we want to address the downtown garage related to fees, would be coming back with another resolution for that. So yeah, that part of the ordinance just says, commission, if you want to set fees, you need to pass a resolution to do that. Really the only, the main difference between Aggieville and downtown and this one is we have that section related to registration of your vehicle in our parking management system. And right now that ordinance only calls out the Aggieville Garage. So if you all are giving us direction tonight, when we talk about item 2 and 3 to go get our typo and LRP contract, that was my bad. I think I made this slide. LPR contract to get that equipment and also set fees because that's going to take about 90 to 120 days to get those cameras acquired and installed and set up the IPS system. We would also come back and amend this ordinance to say vehicles in the Aggieville and downtown garage need to register their vehicles in the parking management system.
Okay, so how about we entertain a motion on the ordinance, and then we'll talk about the other 2 pieces.
I move that we approve first reading of an ordinance amending Chapter 31, Article 3, Division 5 of the Code of Ordinances of the City of Manhattan, establishing rules, regulations, and penalties for violations of parking within the downtown garage.
I'll second. We have a motion and a second. Please call the roll.
Commissioner Motta,
Yes.
Mayor Butler,
Yes.
Commissioner Adamchak,
Yes.
Commissioner McCullough,
Yes.
Commissioner Opelt.
Yes.
Motion carries 5-0.
Okay, on the next 2 items, we won't be taking a formal vote, but just, feedback, try to reach some consensus. And so let's talk about the LRP contract, which is the license plate reader, I guess. LPR instead of LRP. That'd be long-range reconnaissance patrol and Army stuff.
Yeah. For number 2, there's not much to necessarily talk about. If you're not going to charge any fees at all, and if we're not going to enforce parking in the downtown garage, then I've talked with Adrian, and we wouldn't be bringing back that contract, and we'd be doing what we are today, which is a very limited enforcement of vehicles in the garage. and which is harder for us to react to. So I guess I would recommend we should have numbered this differently, and we talk about the fees and what you want to do in the downtown garage and Aggieville, if you'd like to talk about that now. Because if we're going to do something, then we're going to come back with that LPR contract so we can start using that license plate enforcement. Whether that's all vehicles, so Adrian kind of laid out two approaches. There's that rate structure that has any user, if you're going in for an hourly rate, you're getting that $2 an hour. And then we're also having, certain rates for conference goers or hotel guests, which they can be input into the system, not necessarily through Park Mobile. Again, we can give them the access code. We could set up, the hotel registration folks with our IPS system so that when someone checks in, they can put in their license plate, and then that can go into the system. If you're not going to charge the conference goers or the hotel guests, but you still want to charge anyone else who wants to use the garage, whether it's for an event or they're downtown, yes, then we're still going to use LPR, but then we're looking to probably that transient guest tax revenue to fill that gap, because that's where you're not going to make a lot of revenue, but you will be able to enforce all the users of the garage, whether they're a hotel guest, a conference goer, or they're just using the downtown garage to access downtown.
I want to clarify something on this ordinance, because there was a question that this ordinance would make it unlawful for someone living out of their car in the garage. There's a nuance to that if there's not a fee being charged in the garage. And I'm not advocating whatever you do in the downtown garage, but to understand it, if you're not charging a fee, the ordinance says that it's unlawful for a person to camp, set up any structures, or deposit, leave, or abandon personal property within the garage outside their vehicle. Camping is generally setting up some type of tent or structure. The other rule that would apply is the 48-hour rule, which applies to the parking space. So actually, in the absence of a fee or some kind of time restriction, somebody can continue to move their car every 48 hours. Whether or not they're camping in it is going to take some evidence that our staff is going to have to gather in terms of them sleeping there and staying there and all of those things. The reason this language worked in the Aggieville garage is because you have a fee for how long for staying. So at some point, they're over time, and you're able to eject them for that. So I just want to be clear that you understand this. We do not have an ordinance for the downtown garage that prohibits people from living out of their cars if everything's contained in their vehicle and they move it every 48 hours, unless there's some other kind of time restriction on the garage related to a fee.
Thank you.
So you know that for part of your conversation.
Thank you, Katie.
They can't merely pay the fee every 48 hours?
Pardon?
They can't merely move and then pay the fee again?
They could. I mean, they could do that in the Aggieville garage. It's just a disincentive for that. So, and they could have other behaviors that would violate garage rules, but simply being in your car, as long as you're not violating in any other rule and you're paying the fee and you're moving every 48 hours, we wouldn't be prohibiting that.
When the Aggieville garage first opened, we did have a couple of individuals who were used to camping out of their car in the downtown garage, moved to the Aggieville garage, and once they realized that they had to pay to be there, they left, and we haven't had that issue since.
See, as I look at this, and I know we had massive discussions about all of it, I think we've got to go with the license plate reader system and come up with some fees. And I would prefer to just mirror what we're doing in Aggieville with one major exception, as Brad stated. If you've got contracts with people coming for conventions, and there's a case where it's a special event and you need to just give them a code and say, okay, that's going to cover just that, but you could also do that on things like, Festival of Lights down there, maybe people want to stay 3 hours, so for Festival of Lights, we come up with some special thing for just that. And I think the museum may bring in a little bit more traffic when that opens, the Light Museum here in October, and get with them on that. But I don't know what the revenue streams would be. It doesn't model Aggieville exactly, but we should try to keep with the same structure, but then put in those exceptions so that you know, as Brad says, we don't chase off, you know, these big conferences that are planning to come here. And that doesn't make a lot of sense. And then you're right, you know, once you gather your data, if we set up a detailed structure like that and you determine that, you know, we're gonna lose, you know, X amount of money and we won't have enough to maintain the garage, then we should perhaps look at that transient guest tax, as we talked about before, to fill the hole. But it shouldn't all come out of transient guest tax, and that's sort of what my thought is on it.
I would echo you. I think we need to investigate how we can make this work, because we really do need to put some repair and remediation into that building, and we certainly don't have $1.4 million sitting around in any other form. So I would suggest that there are ways we can be flexible, and to our hotel, you know, patrons and to other people. But I would also suggest that having been to all kinds of events in lots of other places, parking is just an expense that you know you have to pay for. And you know, I don't necessarily think every time the Discovery Center does something, we should you know, exempt them or something like that. It's just, you know, it's one thing if you know ahead you're going to pay for, you know, you can, like in the old days when we went to the drive-in movies, we got 12 people and put them in the car, so, no. Anyway, I think we just need to examine another source, another revenue source to correct the deficiencies of the present garage and take the vines off.
Agreed.
Yeah, so I know, like, whenever, you know, all the hotels in Kansas City, they charge $20 a night for parking in their garages. So, I mean, I think even if we do $5, that's, you know, $5 or $10 for some of those folks. I definitely hear you on the contracted events and things like that. You know, but also, are we going to really lose out on contracts over, you know, even if you have 100 people come in, that's $500. Are we going to lose out on a $50,000 contract over $500? To me, that math doesn't really work out. But we do have to have some kind of revenue stream for this garage. I've always been kind of shocked that it's free, and now we are seeing kind of the effect of having a free garage, is that it is going to cost us a bunch of money somehow. I mean, not somehow, but we're going to have to find money to fix that somehow. That's just part of these services that the city provides. You know, finding the money to build it is one thing, but then you have to operate it and maintain it. And if we don't maintain our garage, nobody's going to want to park there because it's disgusting. So yeah, we gotta figure out some kind of structure. Yeah, most places you go to, you just kind of expect that you're going to pay for some parking. It's really not that big a deal. I do have a question about how many people have we had living in their cars in these garages?
One in particular lived there for over a year.
Yeah.
It took my efforts to get his ass out.
If Adrian could speak into the microphone so our public can hear this who are viewing.
Yeah.
Thank you.
We have had, on average, 1 to 2 people or 1 to 2 persons every day living in the garage. We have taken steps to, within our legal boundaries, to prevent them from sleeping in the garage. We've added fencing into places where they would typically sleep to prevent anybody from sleeping there. We're starting to see less of it, but it is still an issue.
Now I know this may be going over the bounds of your job as a parking director or our job as a city, but do we offer those people any kinds of service, help, or get them to an organization that might be able to assist them so that they don't have to live in the garage or live in their cars?
They're aware of Be Able,
Sure.
Which is across the street. I think everyone knows each other on a first name basis by now.
Mm-hmm.
The people that do sleep in the garage are well known to Be Able on a first name basis. There are issues with the rules at Be Able that allow you to use their resources and stay in the shelter. and their compliance with those rules, which is why they are not there and they're in our garage.
Okay.
Can I just add, I think it's really important that the parking structures are a place where people feel secure. And, you know, when I go to meetings late and then walk out as a single woman, I don't really like parking structures that well. I mean, and so I'm pleased to hear that you're adding more cameras and that kind of thing, because I think really, you know, if you have a bad experience in a parking structure, you just don't go back there. And, you know, that's just the way it is. So I think it's important that while the people sleeping in the garage may be really wonderful, kind, but displaced people, it creates a sense of unsafeness, if that's a word, that you might have.
Like in the Aggieville garage with all of our cameras and how well lit and well maintained everything is, we have not had a major crime occur in the garage since it opened. So, and so I think that speaks to how well my staff has been keeping it clean and secure and safe for the users of Aggieville.
And plus, the ordinances give RCPD the tools they need to do correct enforcement. So that's very important, but that's a great statistic. And then we need to make that apply to the other garage too. So John, what are your thoughts on?
I'm fine with how you outlined it.
Okay, Susan?
Yeah, I concur with the remarks other people have made. Nothing new to add.
Okay, so does that give the staff sufficient feedback, or do you need?
I just want the commission to know that if we are going to draft a fee structure that allows exemptions for a private user, then it's going to apply to all similarly situated users. We can't have a fee that exempts one specific entity unless there's a basis for that, or we can provide a public purpose for that. So there are ways to do that. There are some communities that have a special event fee that they define it, and there's different qualifications. There's some that enter into contracts with a high user, and that there's a discount or some other type of approach to it. There's different things, and we can come back with those. But I want to clarify that we can't do a fee resolution that just says one user doesn't have to pay the fee.
Well, how did K-State let us all have free parking if we went to that luncheon the other day?
They had a code.
I know they had a code, but I mean, their state paid for institution too, and they must have had some ability to either validate or, there's got to be ways to let Brad have the people who come for convention have a free parking place or something like that, you know.
I don't know what happened at K-State, but what I can say is there's two different things that you're describing there. One is where you can provide a process that somebody, the host, validates someone else's parking and provides that to their guests. That's different than a fee structure that says their users never have to pay. I just want to be sure those are two different things. So they can anyone could buy those spaces and pay the city for that, and they could provide that validation code. But that fee is being paid by a private entity. So just making sure we're clarifying those two things.
Commissioner McCullough, before I started working for the city of Manhattan, I was the assistant director of parking at Kansas State University. So typically in those situations, what would happen is that the organizer of the event, whichever department within the university, whoever's holding that event, would actually pay us for the parking. They would give their guests a code or a validation of some kind to park in the garage. We would count how many validations we sold, and then we would bill that department on the back end for the cost of that parking. That's how the conference attendees were able to have free parking in the garage.
Well, let's work it out so that we can be as flexible as possible.
Yeah, promo codes, event thing, whatever's legal. I think that's what we're looking for, and whatever's easiest.
So you're looking for a scheme just like that Adrian just described, right? So that a user or a host could pay that and we would validate. I just want to clarify,
Yeah, if that works, I mean,
okay.
you know.
So we would end up paying for it? Is that what
We-
you're saying?
Well,
I just want to be sure we bring the commission back what they're looking for.
Yeah,
Talk about two
that's,
different
you know,
approaches.
Brad's comment there, you know, they would end up paying for it under that
Well, didn't
scenario.
you say we could do a contract with a high-capacity user that could be specific to them? So if he's a high-capacity user, we could either give him a discounted or a no rate because he's connected, he's a high-capacity user, and we sign a deal with him that says that's
You
it.
could only do no rate if there was a public purpose served and you offered the same no rate to similar requesting parties. But you can do a discounted rate, like a bulk rate. That's pretty common with high-capacity users. But in terms of free, that's different because you're basically exempting one private party, unless you're going to offer it to other similar parties and that you can describe the
So you're
public
saying like the
purpose
other
of that.
hotels in the block?
Right, well, other similar, or even an event.
Who
someone
may
else-
be going to the same conference?
For example, if someone hosts a big event in Blue Earth Plaza, they might want free parking. So potentially you're undermining your revenue. It depends on how we write it. I'm trying to determine what you're looking for so we can bring you a proposal to react to, but there's just two different things that you're describing. And I don't want you to be misled as to what we bring back in terms of, it can't say one user is exempt from a fee.
I wasn't looking at it that way.
Okay.
You know, it's a case of like, if he has a conference come in, they may stay in 4 hotels down there. And as long as Adrian could give them a promo code, now who pays for that? Good question. I mean, we would just be taking it on the chin if we just gave out the promo code, and that's one way to do it.
And that is a majority of the usage of that garage, and that's where a majority of the revenue to cover these expenses would come from. So if we're saying that, however it happens, conference center guests don't actually pay for the parking, we need to figure out how to make up that loss.
I guess I kind of agree with what Peter's comment. I find it hard to believe that if you have a conference with 100 people attending, that they're going to withdraw from a contract or cancel. That's going to be a tiebreaker or a deal breaker. And I think, you know, we had a lot of the same debates when we started charging for parking at the airport. And, you know, Manhattan is becoming a larger place. We need, you know, it's not out of line with what other comparable cities are doing.
Yeah, see, and if I was running a hotel, this is what I think they do in other cities where it looks like you get free parking. I sign up for a conference and it cost me $110. But $10 of that is going to the parking. And it's just not visible, and that's how the code could work. And so I don't really see the issue, you know, the whoever sets up the conference rates, you know, unless they're already preset, you know, you can absorb the cost, and that's sort of the way I'm looking at it, and, you know, and it sounds like the Hilton's already charging them $10 for parking, so what's the issue?
And it can be done. I did hotel. I did hotel parking for conferences and valet parking for 6 years. It can be done.
Okay, so I think we're all sort of in agreement. We don't want to damage anybody's business down there, but of course we want to be legal about it, so is that good enough?
So what we would do is come back with probably a draft resolution, a fee resolution for the downtown garage that would address that structure. At the same time, what we could do though, what we want to do now is come back with a contract with IPS, because it seems like there's a clear majority of the city commission that wants to enforce with license plate recognition and establish some fee structure. So we would come back at a meeting, probably the next meeting, with that contract to purchase that equipment with IPS. That takes some time to purchase, install that equipment, and then shortly thereafter, we're coming back with that fee resolution. We're
And
down.
then we can work out the
And I think
details.
maybe the fee resolution should be a discussion item initially, and then get feedback.
We can do that,
and
yeah.
We can finalize it.
And
Yeah.
I would just add that, you know, most people who are coming to conferences are receiving some reimbursement from their employer, from their professional organization, and frequently people get paid for or could be reimbursed for parking. It's a legitimate expense, and you know, so it's not as if we're putting a $5 burden on people who carpool to a conference with 4 people in the vehicle, they're not each paying $1.25 for their parking.
Is there, before we shift from downtown, is there any feedback related to the Aggieville rates that Adrian talked about? We've been through 1 year of Aggieville's rate structure, and we've described that. Is there any comments or thoughts or feedback on the city changing that?
I'd like to just continue what we're doing. I think, the Aggieville Business Association's happy with it. I know there was, we had, seemed like days of discussion about the 2 free hours. We talked about none, we talked about 1 hour, and we finally landed on 2. And I think we should just continue it, because we're getting ready to have massive construction down there again. Yeah. And we just don't need to create any more turmoil. And I do understand that affects the revenue. But, nobody can do a calculation and say, okay, all those folks that parked for free for 25 minutes, how much sales tax revenue did we generate in Aggieville, for the city? You can't capture that at that level. And so I think we just have to continue what we're doing.
Yeah, I know I talked about, looking at the numbers for a different fee structure, but I don't know that this is the right time to do it. I think people are just starting to be comfortable with what we are doing. Let's not kick a hornet's nest again.
Yeah. And I think the structures you set up, lowering the employees, the part-time employees, and selling some full-time passes seems to be effective. So any other comments on that, or does that give you what you need?
Thank you.
Okay, well, I think we pretty much reached consensus on what to do, and we're actually going to do it in the order you've got there, 1, 2, 3. So it worked out. All right, on that note, we can consider adjourning the meeting. Get a motion to adjourn?
I move to adjourn.
Second.
We have a motion and a second to adjourn. Please call the roll.
Mayor Butler,
Yes?
Commissioner Adamchak,
Yes.
Commissioner McCullough,
What happens if somebody says no?
As long as we get 3 votes.
Yes?
Commissioner Opelt,
Yes.
Commissioner Motta.
No.
That's a good one, John. Okay,
Motion
we
carries
have,
4-1.
we have 4-1 motion to adjourn, so the February 6, 2024 City Commission meeting is hereby adjourned. Thank you.